Recorded by the grade 9 students of the Philippine Emirates Private School. This is News.
Breaking news! The World Health Organization has declared a swine flu pandemic as the disease continues to spread around the world. Globally, the number of known infections has climbed close to 30,000 with more than 140 deaths. Hong Kong even ordered all kindergartens and primary schools closed for 2 weeks as a deal of positive tests. The Philippines, China, and Palestinian territories are also dealing with the outbreaks. The WHO says it is worried about just how bad is this flu and can it be prevented? Good afternoon. Thank you for choosing AMA News. This is Akea Raquel reporting live.
We are all in this together, and we will all get through this together.
The World Health Organization had been hinting about raising the alert level for some time, but it waited until the virus had spread across for more than one continent. The WHO Director General Margaret announced that almost 30,000 confirmed cases has been reported in 74 countries on 5 continents. The virus was first identified in Mexico in April 2009. It became known as swine flu because it's similar to flu viruses that affect pigs. The swine flu, aka H1N1 virus, is a type of influenza A virus, which are more severe kinds of influenza. It spread rapidly from country to country because it was a new type of flu virus that few young people were immune to. The relatively small number of cases that led to serious illness or death were mostly in children and young adults, largely because many older people were already immune to it. So, Alfonso is now here concerning more about the virus. Alfonso?
Thank you, Akea. So now that we finished identifying the swine flu, let's move on to the symptoms and signs that a person infected would experience. So the symptoms of swine flu are actually quite similar to those of infections caused by other flu strains, and these include having a fever, experiencing chills, excessively coughing, having both watery eyes and runny nose, and the list goes on. Keep note that the symptoms only show after 1 to 3 days after being exposed to the virus. When do I see a doctor, you may ask? Well, it's not necessary to see a doctor if you're generally healthy and develop flu symptoms such as the ones I mentioned a while ago. But call your doctor, however, if you have flu symptoms and you're either pregnant, have a chronic disease such as asthma, diabetes, or heart condition, then you must look for medical help since you have a higher risk of complications from the flu. So what are the causes of swine flu? What are the possibilities and how do I lessen the possibilities of getting the swine flu? Well, Mia will be talking on that, but one of the most common causes of a person getting exposed to the virus or the swine flu is lack of hygiene or living in a dirty environment. And similar to the coronavirus, which is the virus that is most common nowadays, it is transmitted through physical touch and human interaction. This is why you must wash your hands and must avoid human interaction, especially during this pandemic. So now let's move on to the dangers of having the swine flu. Having the swine flu itself isn't a danger or a threat, since most healthy people can fight it on their own. Their immune system can handle it, but to those experiencing chronic conditions such as heart disease or asthma, then it is a high risk for them since the swine flu can potentially worsen their condition. And that is when they have to look for medical attention. And that is all from me. Thank you for listening. Now on to Mia.
Swine flu, also known as the H1N1 virus, is a relatively new strain of an influenza virus that causes symptoms similar to the regular flu. It started in pigs but is spread primarily from person to person. Most cases of swine flu don't require medication for treatment. You don't need to see a doctor unless you're at risk for developing medical complications from the flu. You should focus on relieving your symptoms and preventing the spread of the H1N1 to the other people. Two antiviral drugs are often reserved for a few people with high-risk complications. These are oseltamivir, Tamiflu, and zanamivir, Lenza. Flu viruses can develop resistance to these drugs. People who are otherwise generally healthy and get swine flu will be able to fight the infection on their own. There are also easy ways to prevent swine flu. Frequently washing your hands with soap or hand sanitizer, not touching your nose, mouth, or eyes, staying home from work or school when you're ill, avoiding large gatherings when swine flu is in season. It's also important to follow any public health recommendations regarding school closures or avoiding crowds during flu season. These recommendations may come from many health institutions, but it is best to get a yearly flu vaccination. The same flu vaccine that protects against seasonal flu also protects against H1N1 swine flu strain. You can get it as a shot or nasal spray. Either way, it teaches our immune system to attack the real virus. That's all.
Once again, this is AMA News, where your safety and information is our first priority. Until next time.